who is often considered the father of modern psychology, contributing significantly to the understanding of abnormal behavior. A. Sigmund Freud. B. William James. C. Wilhelm Wundt. Answer is Wilhelm Wundt. Wundt is often considered the father of modern psychology for establishing the first psychology laboratory in Leipzig, Germany, in 1879. While his primary focus was on experimental psychology, his work laid the foundation for the scientific study of abnormal behavior. In ancient civilizations, abnormal behavior was often attributed to A. Evil spirits. B. Genetic predispositions. C. Neurological abnormalities. Answer is evil spirits. In ancient civilizations, including those in Mesopotamia, Egypt, and Greece, abnormal behavior was often attributed to supernatural causes such as evil spirits, demons, or divine punishment. The concept of hysteria in ancient Greece was believed to be caused by A. Imbalance of bodily humors. B. Genetic inheritance. C. Traumatic experiences. Answer is imbalance of bodily humors. In ancient Greece, it was believed that abnormal behavior, particularly hysteria, resulted from an imbalance of bodily humors, fluids, such as blood, phlegm, yellow bile, and black bile. The first known psychiatric hospital, established in the 8th century, was A. Bethlehem Royal Hospital. B. St. Mary of Bethlehem Hospital. C. McLean Hospital. St. Mary of Bethlehem Hospital, also known as Bedlam, St. Mary of Bethlehem Hospital in London is the first known psychiatric hospital established in the 8th century. It became notorious for its harsh treatment of patients. The witch hunts of the Middle Ages were driven by the belief that abnormal behavior was caused by A. Supernatural forces. B. Infectious diseases. C. Genetic abnormalities. Supernatural forces. During the Middle Ages, abnormal behavior, particularly witchcraft, was often attributed to supernatural forces, leading to witch hunts and persecutions. Philippe Pinel is credited with A. Advocating for more humane treatment of individuals with mental illness. B. Inventing the first psychiatric medication. C. Establishing the first psychology laboratory. Advocating for more humane treatment of individuals with mental illness, Philippe Pinel, a French physician, is credited with advocating for more humane treatment of individuals with mental illness and implementing reforms in psychiatric hospitals in the late 18th century. The 19th century theory that stated mental illnesses were physical diseases caused by abnormalities in the brain was known as A. Moral therapy. B. Humoral theory. C. Somatogenic theory. Somatogenic theory. The somatogenic theory proposed that mental illnesses were physical diseases caused by abnormalities in the brain or nervous system. This perspective contrasted with the earlier psychogenic theory, which attributed mental illness to psychological factors. The psychoanalytic perspective of abnormal psychology was developed by A. Sigmund Freud. B. Carl Rogers. C. Abraham Maslow. Sigmund Freud. Freud developed the psychoanalytic perspective of abnormal psychology, which emphasized the role of unconscious conflicts and early childhood experiences in shaping behavior and personality. The humanistic movement in psychology emphasized A. The importance of self-actualization and personal growth. B. The role of unconscious conflicts in behavior. C. The influence of societal norms on individual behavior. The importance of self-actualization and personal growth. The humanistic movement in psychology, spearheaded by Carl Rogers and Abraham Maslow, emphasized the importance of personal growth, self-actualization, and the innate drive towards fulfilling one's potential. The term psychopathology refers to A. the scientific study of psychological disorders. B. The study of psychic phenomena. C. The study of human development. The scientific study of psychological disorders. Psychopathology refers to the scientific study of psychological disorders, including their symptoms, causes, and treatments. The 19th-century theory that stated mental illnesses were physical diseases caused by abnormalities in the brain was known as A. Moral therapy. B. Humoral theory. C. Somatogenic theory. Somatogenic theory. The somatogenic theory proposed that mental illnesses were physical diseases caused by abnormalities in the brain or nervous system. This perspective contrasted with the earlier psychogenic theory, which attributed mental illness to psychological factors. The DSM, Diagnostic and Statistical Manual of Mental Disorders, was first published in A. 1980, B. 1952, C. 2013. 1952, the first edition of the Diagnostic and Statistical Manual of Mental Disorders, DSMI, was published in 1952 by the American Psychiatric Association, providing standardized criteria for diagnosing mental disorders. The community mental health movement aimed to A. Increase the number of psychiatric hospitals. B. Provide mental health services in community settings. C. Promote psychoanalysis as the primary form of treatment. Provide mental health services in community settings. The community mental health movement aimed to provide mental health services in community settings, rather than relying solely on psychiatric hospitals, with the goal of integrating individuals with mental illness into society. Ivan Pavlov's experiments with conditioning influenced the development of A. Psychoanalysis. B. Humanism. C. Behaviorism. Behaviorism. Ivan Pavlov's experiments with classical conditioning influenced the development of behaviorism, which focused on observable behaviors and their relationships with environmental stimuli. The term neurosis was commonly used to describe A. Mild psychological disorders. B. Severe psychotic disorders. C. Genetic abnormalities. Mild psychological disorders. Neurosis was a term commonly used to describe mild psychological disorders characterized by distress or anxiety but without a loss of touch with reality, such as anxiety disorders and depressive disorders. The deinstitutionalization movement of the 20th century focused on A. Closing psychiatric hospitals and integrating patients into the community. B. Building more psychiatric hospitals. C. Implementing stricter admission criteria for psychiatric hospitals. Closing psychiatric hospitals and integrating patients into the community. The deinstitutionalization movement of the 20th century advocated for closing psychiatric hospitals and integrating patients into the community, emphasizing outpatient care and community-based services. This movement aimed to reduce the reliance on large institutions and promote the autonomy and recovery of individuals with mental illness.